Welcome to the Patient Voice Amplified podcast as part of the Class podcast series, and right now especially as part of the breast cancer awareness series we're doing here at Class. I have one of my favorite classmates with me, Monique Rasband. Monique, awesome to see you.
Yeah, thank you. Thank you for having me in. Really appreciate it. Obviously a fun topic, and most people don't see me wear pink, so it's really good to break out of my all black and come in and honor the pink. Thank you.
It's a great way to put it. We do need to honor the pink and celebrate. And, you know, Monique, give us your background. Talk a little bit about how you got to Class and what you oversee here.
So I am the Vice President of Imaging and Oncology. And how I got to Class, so one of my colleagues that I worked with at my previous company, we were working in radiology, oncology together, actually a couple of colleagues, and they kept telling me about this great company called Class. And I was like, what do you guys do? And they kept mentioning all of this writing of reports, which didn't really sound that exciting, quite frankly. And I said, oh gosh, I don't know. It was like 2 years of talking with them. And I'm like, sounds great, but I'll miss my providers. So I don't think I can make the jump. And so they were not great salespeople at sharing how much we get to work with providers, how much we get to really dive into it. So I'm not a clinician. No one will give me credit for being an IT person. So actually it's really kind of crazy I landed this job. And but it's fun to learn from really solid IT professionals. The equipment side, I am a big equipment geek. Took a tour of a facility yesterday and was like literally on cloud nine. And then of course, learning from the best, our providers that we get to work with each and every day. And so it is really fun as I ask a lot of questions. I think the strength is that I'm not the clinician IT guru, so I have to ask more than others. And then I love the patient side of it. And so that's what is so exciting. So asking and then being the go-between of trying to connect all of these things together.
Awesome. Monique, that's one thing I've always admired about you, your deep passion for serving the provider and helping them. I think our listeners need to know we have an award called the Provider Hero Award, and it's affectionately called the Monique Rasband Award. And I really admire that about you and how you truly focus on your provider friends and what do they need and how can we serve them. And so any examples or stories you want to share there? I mean, you talked about that was one thing you loved at your previous role and how much you're into that now, but maybe the way you try to grow knowledge about imaging and those things in your role now. Any examples you want to share?
Gosh, there's so many examples. I came in at a really interesting time to Class and obviously had a lot of equipment background and some IT background. I work with a lot of cancer centers, and you would work with a lot of breast centers, and they would talk about the radiologist, the oncologist, and they closely work together. So it's interesting then. I thought, wow, the technology, and my previous role, I was really lucky to go, or my previous company, to go out and watch respiratory gating. And I was like, wow, we're here, we've completely, and now if you said that to someone, they would go, yeah, respiratory gating, like that's just not even that exciting anymore. It's just very common. So just watching that come about, and even watching some of the shift from CR to DR, and then 2D mammo to 3D mammo to tomosynthesis, 3D mammography, and then breast ultrasound, breast MR. So I feel like the timing, I know people that have before me and people after me will have their own sort of pieces that they've seen, even the adoption of PACS and VNA. It's just really, really cool to see where we've come, but obviously there's more. You talk about cloud, AI, like what is the next generation, like what's the future? And then patient engagement. And that's the part where before, I am very loud voice. They actually had me move my microphone down. And you would talk to patients and I would say, so did you get an ultrasound, a breast ultrasound? Did you have 3D mammography? And they would go, huh, what? And now it's the opposite. So I would always tell people, ask the equipment, ask this, ask what you're having, ask, do you need to have this? Ask about the breast density. And for a while, it was the joke that none of our friends would let their wives around me because the topic somehow led to women's imaging and healthcare. And so now it's fun that I don't do that nearly as often because people are coming to me with the questions And again, we mentioned I'm not a clinician, not IT, but it's awesome that I can go back to the provider friends and bring them into the conversation. But the education and the patient engagement has changed, which is awesome.
Let's talk about that for a minute. So obviously we're still coming out of the pandemic, and what have you seen and noticed regarding patient engagement and what patients are doing or haven't been doing?
Yeah, that's a great question. And I still hear from my provider friends that mammography has not quite caught up to where we were in a regular routine. So with October, with the education, I think everyone knows there is some confusion about when do we get it, what do we get, 2D, 3D, a breast MR, ultrasound. But it's fairly known, it's yearly. And then when you send the exams, the self-exams monthly, when you think about COVID, all of those routine the screenings were canceled and moved, and that was for quite a long time. And then depending on where you were regionally, some of those hospitals and cities struggled more, and so some of that was pushed back. So the facilities and the providers are absolutely ready to go. They are at full capacity. But as patients and as busy humans, we got off of our schedules. And then if you were supposed to be at screening early in the pandemic, by the time things came around, you really could almost be 2 years out.
Yeah.
And even now, sometimes I talk to friends and I'm like, oh, I know I need to get back in there. I haven't been in since the pandemic. And I'm thinking, that was a while ago.
Yeah.
And so just a reminder for patients to get back in and get back in their routine. And not just the patients, like we think about, okay, that's everyone, women over 40. No, that's everybody. And reminding your friends and family and asking, have you had your mammogram, or do you need to go in, like what's going on? So we need that help. The other thing that I think is really fun from a patient engagement, and another area I'm really passionate about, is the image exchange. And when I first learned of image exchange, and we were at RSNA many years ago, and I was thinking, wow, by next year, everyone in the world will be using image exchange. I really thought that. Fast forward, not the case. And so during the pandemic, that was interesting too, because patients, we love to go in, we want to touch that tangible CD. No one knows where it goes later. We all lose them. We don't know what we're going to do with it later. But there was something about, we want that burned to a CD, where the pandemic changed and people are saying, we do not want to get near a hospital. We don't want to go anywhere to pick stuff up. And so I think from the provider standpoint, as well as the patient standpoint, that engagement became, okay, do I really need it tangible? And is there a way I can get involved? The portal usage came up. I won't quote the number because I've heard that all over, depending on the provider. But I constantly hear about the portals going up and people getting more involved. So that's really, really cool. That
is cool. You know, just to marry that comment with some things that I heard at a conference this week, you know, patients are voting with their wallet, and they're wanting better access and more convenience and better communication. And so apart from going in and getting the CD, and hopefully we're seeing better forms of image exchange, are you hearing of anything else that really helps the patient feel that convenience? And you know, the word of the day is consumerism. We hear that left and right. And so I'm curious how you're hearing about that related to exchange.
Yeah, absolutely. It is definitely just easier, convenient. You think about the driving, people aren't going in to work as much anymore. We are more remote. Yep. So just that has changed. And the other thing that is not necessarily directly tied to the exchange, but more the mammogram and the patient experience, we're seeing providers that talk about and talk through their spa-like experience for women's imaging. Okay. And that was already started. That wasn't the pandemic, but that was something that I think really started with the patient engagement and how it pushed and started moving into the imaging world. And someday I'm going to get out and see all these patient centers myself. I love visiting. When we're on vacation, like drag everyone, like, we got to go see this. It's really fun to go see providers and see what they've done. But they talk about, we don't want that experience of being really clinical. You're going in for a screening. And so I know some people go in routinely, they don't think about it. I know other people that days leading up to their screening, they're like, oh no, what if this? They're scared. Yeah. And so it's nice walking in and not feeling like a really sterile environment. And it is more like of a spa feeling.
Interesting.
And even some of the scents and the different things that providers tell me that they're doing to engage that patient and make them feel more comfortable, and also make the person they're with coming with them feel more comfortable, whether that's a driver or someone's coming in for a biopsy. Routine, many times you go alone, but also how many busy moms have the kid in the lobby or have someone that's driving them through different procedures. And so I think that's nice too, not just for the patient, but for the family.
I'm thinking of my wife Janet's experience. You know Janet well. You were an amazing support through her breast cancer journey, and we should talk about the other panel that is part of this breast cancer awareness series. But that when you say a sterile environment and it feels like you're going to the post office and it's just it wasn't very personable, and I'm thinking more of the diagnosis and how challenging that was, but. So what other examples are you seeing just from imaging and treatment? Anything else that you've noticed, advancements that you want to share?
Yeah, I think that, because I hear all these wonderful providers, so I know that AI is changing. It is really, really early, but there are some algorithms and some different pieces that are making a difference. And, originally, again, being in the middle of this at the time, and again, we'll look back in 5 years and you'll laugh at the interview, so that's okay. That providers were originally, the radiologists were like, oh my goodness, are we going to be out of work? Like, is this going to replace? Absolutely not. And now we're seeing, no surprise, the volume for everybody, they're really overwhelmed. There's shortages. All of that. So we're playing into AI is a companion to the amazing work that radiologists do. And I have not now, fast forward current, talked to providers that are nervous or saying this is putting us out of business. They're grateful for the companion and how can they be more efficient and bring things to the top, or even in certain ways, I think we'll learn a lot more going forward. Because again, it's pretty early. But that's really fun too, to have another look, another expert. And there is definitely something about that human. And there's also something about an algorithm, right? So marrying the two and having the benefit of both, it just doesn't feel like one or the other will necessarily be replaced. And it's really fun to see some of those things happening with mammography and AI.
I'm hearing the same thing, that the question isn't, will AI replace clinicians? But the statement is, clinicians that don't use AI will be replaced. And to your point, you still need that expertise and you want that knowledge of your clinician. So I've heard that recently a few times. So, okay, I want to ask you about social determinants of health.
Okay.
And some people struggle with access, and they don't have easy access to care, and so. Have you heard anything, any mobile imaging centers, or, I'm trying to think what I've heard generally, but
absolutely.
What are you hearing about that, serving that population?
Yeah, and I love that you asked that question, because I see them on the road here and there. You hear about mobile, and then it's interesting. I had someone say, well, this and that, and there's different reasons I wouldn't want a mobile. And it's like, that's great. I love when people have their opinion and they would not want a mobile, or they would want a mobile. The bottom line is there are people out there that don't get to the facilities. And so if there is a mobile out there and they make it to it, it is absolutely better than nothing. And so not just for women's health, but I hear that controversy going back and forth, or people will talk about, well, they didn't have the strength, or they didn't have this. They're getting it, right? So I don't really hear about it as much in our area, but it's really awesome, especially in the oncology space, when I talk to a provider and they say, this is making the biggest difference. People are really sick, really rural, and they're getting to their treatment, where before, again, you don't even remember what day it is sometimes when you're that ill, or you're trying to find that driver, or you're depending on your older child or a neighbor or someone to bring you in. So it's not only the treatment portion, which is starting to ramp up, that we're hearing, but also for, like you're mentioning, the detection and some of the diagnostic pieces. So I'm all about access. So whatever it takes and however we get the care to everybody.
That's awesome. So Monique, one thing I want our listeners to understand is how much you've been involved in this, not only as a research director at class, but you've been involved with legislation that's happened and helped encourage some changes on some things. Will you please talk about that for a minute?
Yes. So I almost got booted out of the state, but that's okay. We made change. So this actually took a long time, longer than we thought. And it was actually funny because you guys were involved as well. And our founder, Kent Gell, his wife we've always talked, again, back to the husbands, don't let the wives hang around me, because we talk about women's imaging too much. And she had a neighbor going through some things and just chatting, and she said, you should reach out to our friend, Monique. So we started talking, and I was sharing with this lady what had already been happening, which was not super successful. And really the press was just for if someone has dense breasts, just being aware and let them know. And I can't even take the credit. I literally met a patient at a conference, Dr. Nancy Capello, and she was telling me about this and telling me how she regularly was getting the mammograms, and all of a sudden found out in an annual that she was stage 3. And it's like, wait, how do you go from stage 3 in a year? You usually don't. That it's possible, but usually don't. And just talking about the density. And so those who have not heard of this, if you Google it, it's very, very simple. And for some people, the mammogram is very easy. So even my non-clinical background, I can see it. And then others, even the most trained radiologists and even the equipment, because of the density, it just forms the fibrous tissue. They're really white, and so you're missing that. And so just hearing her story and what she was doing, I was like, we're going to do this in Utah too. And so once they contacted me, again, after I'd contacted many times, but the patients here said, we think we have a run for it, we have a connection. And we reached out to everyone and said, send letters on pink paper, do what you need. Like, we have to be heard, the voice is heard. And actually we had published some class reports, and that was pretty intense to talk to a provider to say early on, yeah, this happened and we caught stuff, and the person probably had it for some time and didn't know. Had they had known they were dense, or they would have requested more information, or potentially had an ultrasound or an MR, we'd have caught it sooner. And so just putting those stories, and it was actually pretty cool that Utah did put that into effect. And I got to go to the Capitol and have a little celebration, and they signed the bill. Yeah, super cool. Yeah, so I'm not political, so I usually don't know who's running. So it's actually really funny. And even when I was going out there, my friends were like, really? You got invited up there? I'm like, yeah, crazy.
That's awesome.
So anyone can do it.
So, and what was the legislation that it was to look for that?
To notify the patients. Yep, just to notify the patients that you have dense breasts.
Okay.
And for those of you that don't know, when you get the mammogram, it's actually all part of the mammogram. So if you don't know how to look for it in your patient portal, you can easily just call in and ask, what's my density level? And again, just to be aware, it does not mean you do or don't have, don't have breast cancer. It really is just that risk of, do they need to take a bit of a deeper look? And then just to give a plug to Nancy's website, the Are You Dense, a great place to go and learn, and even just Google, and there's so much now patient information. So even starting when I was really interested in exploring, there was not a lot out there. And again, back to patient engagement, quite frankly, back to your segment, and just how many people that get involved and are making changes that are not clinicians and are not the IT gurus. So everyone truly, truly can make a difference. And I think everyone working together, the radiologist, the physician, the clinician, from all aspects, even the education from the OBGYN. On our panel, we talked about just this earlier this week, and how the survivors found it. And someone said, oh, it was something my OBGYN said, oh, something I found, or it was a regular routine mammo. But we even had a patient, I thought this was so good that she shared. She's also a nurse, so clinician herself, a very, very skilled nurse, and mentioned the moment she had it, someone referred her to a great surgeon. But the skill set and what they had been trained, you only know what you're trained and you only know what you know, said, we need to get this out right away. And the next morning had a full-blown surgery that later she's like, oh, I wish I would have had different opinions. She might have gone that direction, but she also would have had the option of what she learned later on. So that again goes back to patient engagement, and actually your wife, Jana, on the panel said really being the captain of your ship and kind of knowing where you're going. And Janet shared about, I think she said she had 3 or 4 different getting opinions, and everybody was different and everyone had a different treatment. So you remember that well.
About the chemo especially.
Yeah, the chemo.
We were advised 4, 6, or 8 treatments.
By different people.
And I called a family member who's a clinician who said, yeah, those are all good. Just pick one. And we're like, what are you talking about?
You're talking about cancer.
Oh, so and that's something that I hope is progressing and growing more information so patients are more informed. Because literally one of the hardest decisions of our lives felt like a coin toss. It was we did 6 because it was the one in the middle.
Yeah.
Which is kind of crazy, but I know. And I'm so thankful that healthcare has progressed since then.
Absolutely.
Janet was diagnosed almost 10 years ago. She's rocking, doing great.
Her 10-year anniversary.
So, we're blessed to have such good healthcare, and it's progressing. Right?
Absolutely.
It's getting better. So,
absolutely.
Will you talk about the other things we're doing this month at class to bring knowledge to our listeners about breast cancer awareness?
Yep, absolutely. So we have a lot of snacks at class, a lot of fun parties. We feed people. If they don't get their mammograms on time and tell their family members, we're completely cutting off the food. It's true.
You're out.
The rest of the company does not know that. That's what I'm personally going to do. So just really education. And on our last panel, we talked about, this is very focused on getting a mammogram. And if you're not 40, and it is interesting, people talk always about the women and we forget to talk about the others. And very unfortunately, the statistics for women, it's 1 in 8. And so if you even just have a barbecue and you look around at the females and you're like, dang, 1 in 8. But the males, unfortunately, even though, of course, less risk, when they get it, it's usually more dangerous for them because they don't find it right away. And it definitely is not something that we bring awareness to. So would love to bring awareness and just even the self-exams for men if they notice any difference. And again, for them, it's even a little bit harder to feel. We go back to the density and just the muscles and the way that it can be masked. So I think that's something that brings awareness. And so that's one thing. Also talking just through how do you support someone? So this is, we're focused a lot right now on the actual patient, but what about the family members? What about the kids? What about the husband? What about the spouse, the partner? And so all of a sudden everyone kind of forgets, like, what about these people that are really in the middle of it? And so that's something that we're talking about too. And then also, how do you support someone? And so just talking through different friends, and they say, don't ask me what I need because I don't even know. Just tell me what I need or just do something. And we asked the panel, I don't want to spoil it, but we did ask, like, what were some of the things? And everyone's like, pick up my kids. Like, I'm not really feeling like food, but bringing stuff for my family to eat, stuff to think about it. Or Helen on our panel mentioned having someone that just her friend sent someone to clean her house regularly. And that was consistent. And she's like, you have no idea what a treat that was, just that someone was coming to clean my house. So that's something that we want to help with as well. There's something we can all do. And then the other thing that we're talking about, I feel like I'm ruining all of our panels.
You're teeing it up. We're excited.
It up, right? The fact that people think about this, I've heard so many times, the self-exams start at 40. No, starting at 20 years old. And if you have any risk, it's okay to start earlier. There's actually not an age limit, right? So just talking about that and the awareness of starting that at age 20. And one of my dear friends is a radiologist, does a ton of women's imaging. I've heard him many, many times for his whole career. He hand writes Christmas cards to the patients that he diagnoses. And he said it's getting out of hand. And then the women under 40 is what was for him. He's like, this is crazy how many women are under 40. And ironically, in our panel, correct me if I'm wrong, I think all of them were under 40. Maybe one was 40, 41.
Janet was 37. So,
yeah.
Well, good. And I think that's the point of be aware and make sure you get the regular mammograms.
Yeah.
And the fact that we're talking about it is so great.
Yeah. Yeah.
Right? Because, you think about what the NFL does.
I love it. I love it. Yes.
Delta Airlines.
Yes.
You can buy the pink lemonade on
Yes.
Delta right now.
Just flew yesterday. Thank you, Delta.
I got the free headphones just because they were in a pink BCA
Yes, I love
envelope.
it.
And
yeah.
so it's a good thing. And I think it's important that we keep talking about it. And, for some, it's terrifying just to go.
It's terrifying to go.
But I'll tell you, I am so thankful that Janet went when she did.
Mm-hmm.
It's in our rearview mirror.
Mm-hmm.
And, you have such immediate empathy for women and families going through that.
Absolutely.
And so it's absolutely essential. It worked for our family, and really, really grateful for that. So anything else you want to tell our listeners today?
Yeah, it is culture. And so it's now been I have many weaknesses. One of them is time. And so this is, I'm going to say a handful of years ago, because I honestly don't know how long ago it was. But I was really lucky to be a part of Radiology Without Borders. And we went over and donated, one of our awesome providers donated an old 2D. For them, it was something they were not using. So we raised money and took this thing over to Africa. And I had pins donated, pink ribbons. I mean, it was like, in my mind, what I pictured was so perfect. And we get there and these women were like, you want me to do what? While they're breastfeeding openly, they're saying, you really want other women to have a mammogram? And it was just interesting that they were not as excited. I think I was a little intense handing out the pink, and they're just like, interesting. And it actually was such a reflection of that is how, when you talk about the NFL and you talk about the Delta headphones, when we see pink, we immediately know what it is. That was not always the case. Our children, our generation growing up, they will never ask what that is. They will learn that instantly. They're born and they know.
Yep.
And so it really is about culture and the education and even talking through it. And I love even the younger people, even people in my generation, to ask someone, did you have your mammogram, might be a little odd. Younger kids, younger people, and just making sure their moms, aunts, grandmas, neighbors. My little niece, she's like, we need to go on the trail and give out pink lemonade to remind people to have their mammograms. And she's, since she's little, we talk about stuff like that.
That's great.
And her wearing her pink socks during October that have the little ribbon. So she's grown up with that. So I think she will not have a problem getting it, but just helping it to bridge the gap of the generations. And again, it comes back to the ironically full circle to patient engagement and education.
Yep. That's awesome. Monique, so grateful for our friendship. You are a leader in the industry and here at class, and can't thank you enough.
You're too kind.
We've learned a lot, just the
Thank
passion you have for the topic, but also the way you take care of provider friends. It's really inspiring. So
well, they take care of us. So in turn, right?
Yep.
Just this morning, I was texting with one of our awesome radiologists up at the U. And I was like, I'm so sorry to bug you, but I truly need someone that will not sugarcoat it. And he's like, I'm your guy. And I'm like, I know.
Yep.
I know. So we learn from them. So thank you to all of our provider friends. And at the end of the day, we're all patients, right?
Right.
Yeah, so we appreciate it. Thank you for having me in today.
Thank you. That was awesome.
Thank you.